Welcome back. I'm Dr. Alan Gaveck. I'm honored to have with me today Paul Bogaardt, clinical research facilitator for Heartstem, NewStem, PetStem. Paul, thank you for coming today.
Thank you, Alan.
Paul, you've been around stem cell for a long, long time. You work in the research side and writing IRBs and really facilitating the projects that we see the results of the stem cells. Share with us some interesting stories that you've seen in your experience.
Yeah, it's been quite exciting because working on the research side, we even get to interact with the patient sometimes. A couple of cases that really stick out. We had a lady, an elderly lady of about 82 years old. She was diagnosed with coronary artery disease, basically the typical signs of heart failure. Right. At the time that we met her, she was unable to ambulate out of her bed to her mailbox at the front of the house. And at the time that she came in, we felt that she was a candidate definitely for the procedure, the stem cell therapy procedure. She was scheduled to go on a trip to Japan 6 months later, but had canceled that because just simply due to the fact that she was unable to move around, to get around. We took her in and we went ahead and we went through the therapy. We screened her, we went through the testing, we took her vitals and then went through the therapy. Within the first week, changes already started. She had started to report back that things were improving. 3 months after that, when she finally did go to Japan, she reported back to us that she had actually walked 7 miles in 1 day. And this was just phenomenal. Now, when we go through the IRBs and we talk about the different types of endpoint criteria that we're trying to nail down, because it's wonderful to hear the anecdotal stuff, right? But what you really want is you want the scientific, where's the real meat and potatoes.
And what is that endpoint that you find the most critical with IRBs?
Well, in the particular case of our studies, because we
Heart failure,
absolutely. Correct. Yeah. So in the particular case of heart failure, we're looking at something called ejection fraction. So it's really simple to conceptualize. Essentially, your heart is pumping blood, and it does that your whole life. And as we get older and as calcium and plaque build up in our arteries, the heart gets a little less effective because of calcification and other factors that create that ejection of blood as it's circulating through the system. So this is termed the ejection fraction. And so one way to know that you're dealing with a heart failure patient is that the ejection fraction is less than 45%. So this is just a number that New York Heart Association says is someone that's symptomatic of heart failure. When we take a patient in, part of our criteria for coming into the study is that they have an ejection fraction of less than 45%. And when we give them the therapy, we will then measure that ejection fraction by echocardiogram to determine whether or not that ejection fraction actually goes back up, closer to where a healthy patient would be, let's say 60, 75, 80%. And at this point, we have to say that we're still at the very early stages of many of our studies, of this one in particular. There is already anecdotal evidence within the past few months that this is improving. And so the jury is still out, but what we can say is that the patient's vitality, their 6-minute walk test, which is another endpoint that we measure, how fast can someone walk or what's the distance someone can traverse in a 6-minute period. These all become part of measuring success.
And the QOL.
And the QOL, absolutely. Indicator.
Perfect.
So, yeah, so it's exciting. And there's a lot of different ways that we're looking at taking these initial studies and then using them and the knowledge there to springboard into more scientific ways to proving out not just the safety, but also the efficacy of stem cell treatment.
Perfect. Paul, thank you so much for coming in today. I look forward to having you back to hear more of your success stories and some of your endpoint successes for your research.
Great. We'd be honored to be back, Dr. Gaveck. Thank you so much.
Thank you.